We're back here on Fox 51 today with Dr. Svetislava Vukelja to tell us about the Tyler Breast Conference for 2013. Dr. Vukelja, pleasure to have you back here on Fox 51 today. We appreciate it so much. This is such a big deal here in East Texas, especially here in our own family, our own Jennifer Keelman, a breast cancer survivor.
Yes.
So this is a special issue to all of us here. This is going to have some great information at this conference, broken up over 2 days, the 22nd and the 23rd. Firstly, let's start though. What is the Tyler Breast Conference 2013 and where will it be held?
Okay, so it's held on at Convention Center. At Harvey Hall.
Perfect.
And it's our 16th year.
Okay.
And it's a full-day conference for medical people, such as physicians and nurses and surgeons and radiation oncologists, technicians, and it's basically covering what has been discovered, what has been changed in last year, what are the advances that we made, and it is tremendous information that we bring right here home, so you don't have to travel to our community, because we are really kind of on the cutting edge of breast cancer research and treatment and advances.
Absolutely. So speaking of that, the event Friday evening is open for the public.
Yes.
So what can they expect to learn about breast cancer at the event on Friday?
Well, you know, usually we in the past we have had different speakers giving information. This year I'm going to do a little bit differently. This year I'm giving the talk myself.
Oh, great.
And I'm going to talk about, I think, issue that's very dear to our heart. What are the ingredients to be a survivor? What are the things that I have observed in the last 31 years that takes to be a survivor? What does it take?
Yeah.
And so I think information is not just for cancer patient, but survivor in general. We are survivors of all kind of things in our lives. So it will be a little bit different. So I think that will be also very enlightening and inspiring. And so every year we do it a little bit differently.
Absolutely, and not just even for survivors themselves, but I'm sure friends and family members who have, because we know this is a struggle together. We go through this all together, not just the person who has the cancer.
So it should be a good evening, and it's free, and I think it's, you know, hopefully there will be a good
Wonderful. It's not every day you
people.
can get great information like that from someone like yourself. Now, the Saturday event for physicians and medical personnel, so what can they expect to gain from attending on Saturday?
Oh, it's going to be terrific. It's going to go from imaging, you know, how do we pick up cancer, how we discover it initially, what are the information that we get from biopsy, and now we are kind of leading towards target therapy. In other words, not every breast cancer is the same. You know, breast cancer from this woman may not be the same as breast cancer from that woman. So we are targeting the treatment based on the biopsy of that particular patient. And so that is what we're calling target therapy.
Okay.
And it's a personalized medicine, and that's really the culmination of the research that we accumulated over years. And every year we add another piece to that puzzle. So I think that's going to be a great information.
Well, speaking of that, are we making great strides in the fight against breast cancer?
Absolutely.
Great.
And I think that's the only way we're going to conquer this disease. We don't want to just early detection. Early detection means you already have it. We want to prevent it. So we're learning also about other prevention factors, not just treatment once you have cancer, but we want to prevent it.
Wonderful.
So we are making huge, huge progress.
Well, Dr. Vukelja, what do people need to do if they want to attend these seminars?
So, you know, you can register on site, or you can register online for Saturday, and we have allowed some breast cancer survivors to come in too. And the night before, of course, it's free. You just show up to Convention Hall.
Oh, wonderful. Dr. V, always a pleasure. Thanks for stopping by here. Thanks for the great information. We appreciate it. Thank you so much. We appreciate it.